So I work as a SH level doctor, and we work together with all the nurses to look after patients that underwent major surgical operations. I think working as HDU is very nice because all the nursing staff is happy working there. They have great staffing numbers and they are very well supported by the medical team, which is always in the unit.
So Surgical HDU is a unique unit. We're small, we have 10 beds, and we are able to really get to know both each other and our patients really well. One of the great things is that we get to learn loads. We get to learn about how the body works, and we're really supported by the consultants on the ward rounds. They talk to us, they explain things to us, and they really take on our opinion.
So on the surgical high dependency unit, you're given the education and training to look after critical ill patients post-operatively, and with that training and education, you're given more responsibility to look after these patients. For a newcomer to come and work in it, it's very welcoming. Everyone's friendly, they're happy for new people to come and work. It is a great place to work, and it's more like a family than coming to work. You're coming to work with your other family.
I started here as a newly qualified, and that's a very scary time for anyone. But the team here were incredibly supportive, and the education opportunities were amazing. I was given on the unit training. I was able to take my own time. I finished my Step 1 competencies within a year, and there's many other courses that you can get onto, such as the Neuro Foundations and Full course, or the ICU Foundations and ICU Full course.
So we work really closely with the whole team in NeuroITU, and that's nurses, the technicians, our therapy assistants, the healthcare support workers, the doctors, the consultants. And it's really a really big MDT approach to try and get patients rehabbed as fast as possible, really. We work really well as a team, and it's really rewarding together to achieve those goals.
So as an ACCP, we work on the medical rota alongside the junior doctors and support the consultants. So after a 2-year programme of training, we developed skills to assess, diagnose and treat patients, and also develop advanced clinical skills.
So during our training, we spend a period of time on the unit on the intensive care, and a period of time doing anaesthetics, which develops our airway skills. And so during all of that, we learn to put in advanced lines, put in airways, and manage a lot of the needs for our patients here on the intensive care unit.
Well, the thing I love the most about working here is the community spirit. We're definitely a team here, and people not only really care about the patients, but they also care about the staff as well. I really love that sense of togetherness, and to be honest, it's not something that I have experienced huge amounts in the other places I've worked, but here I really feel like people really care about you.
I never thought I'd go into any form of nursing in my life, but with the team, you have that support, you have those one-to-one conversations, and you realise actually I can do that, and that's the main thing about working here. I've realised a lot of things that I actually can do. My favourite thing about working here is probably just the everyday. You know, you've got a routine, you know roughly where you're going, what you're doing, you get a decent handover, and you know, you just go with it, and it's really cool because anything can happen in those 12 hours that you're here. And that's what I like a bit of variety.
Volunteered just before COVID. They were doing a call for volunteers to come up, and I thought I'd come up and challenge myself, do something totally different, because I've been in emergency nursing for a long time now. And I did the second wave of COVID, and then I asked to stay on afterwards. I've really enjoyed my time up here. I've been here about just over 6 months now. It is a brand new department. The staff have been really welcoming towards me, fitted in really nice, very supportive. And I've learned loads and loads of new skills as well while I've been here.
We're very lucky here in general intensive care. We have this wonderful brand new unit. It's perfect for the purpose, it's good for our patients, it's a lot lighter. The reason I love working in general intensive care is the wide range of variety we get with patients. You can have surgical elective patients, you can have emergency medical admissions, and we get lots of trauma, so you never know what's going to come through the door.
One-to-one, nurse-to-one patient, so we can always give them all the care that they need. I've been working in cardiac intensive care for 13 years. Working in intensive care is like a family for me because I know everyone. We've been here all together for such a long time, and people who works here are really, really fantastic.
One of the things that I didn't realise prior to starting here was the different job opportunities available. So there's technicians, research nurses, specialist cardiac nurses, outreach. So there's quite a lot of room for development and career progression. So yeah, I found the unit to be really friendly. It's such a big team, it's quite a big unit. It's really fast paced. And ever-changing. It's also a really nice new unit with quite modern facilities.
I started UHS 5 years ago, started in cardiac intensive care as a newly qualified nurse. I have started by doing the in-house foundation course and progressed to do the Principles of Intensive Care course going back to university, and I've now progressed up to a sister's role. On CICU, we have a really friendly team. We all work really closely together. We've got very high standards of care, which is supported throughout all of our nursing team and beyond.
So in cardiac intensive care, we have supportive staff, and they will guide you all throughout. So even if you have the things that you can't do, it's because you're limited. They will help you to do it, and they will teach you how to do it, because I can always ask somebody to teach me, and they have always been so helpful and so thoughtful. And I have been endorsing this to my friends that I want them to come to cardiac intensive care, because all of the staff here, from the band 7, even from the matron, you can always approach any of them for any kind of problems, and everybody is so willing to help. So I think that's what I am so overwhelmed, and I am so thankful that I came to join cardiac intensive care.